Now, a report into the death of a mother at an Essex hospital has detailed a catalogue of errors and missed opportunities. The report seen by Channel 4 News comes as the Care Quality Commission prepares to publish its findings following a full investigation into Queen's Hospital in Romford. We've learned that 12 women or their relatives are now taking action against the hospital. Our Health and Social Care correspondent Victoria MacDonald has been speaking to one of the women who is seeking legal redress.
It's nearly 11 months since Georgina Lloyd gave birth to her daughter Isla, and still she's angry over the way she was treated by the hospital.
When you're a new-time mum, I think you just depend your whole entire life and what's going to happen the next couple of hours when you have that child on them. And if they say something, you do it because you think that they know what's right, and they do know what's right, but they don't necessarily give the correct care.
And Miss Lloyd did not receive the correct care at Queen's Hospital in Romford, Essex last October. Channel 4 News has now seen the serious untoward incident report written after that birth. It took 3 days to induce her after her waters broke. They did not spot she had an infection and discharged her. The community midwife also missed the infection, so Georgina ended up in intensive care with pneumonia. When she got better, she wrote a letter of complaint.
All that was sent back was quite a few months later, was sent back basically ignoring my letter and it basically telling me that what they'd done wasn't their fault. And I think that really hurt. All I would like is just for you to recognise what happened, to apologise, and then make sure it doesn't happen to any other woman.
Georgina Lloyd and her little girl did survive, but others haven't. In the last year, there have been deaths, 2 mothers and a baby, and numerous allegations about the treatment that women have received on the maternity unit at this hospital. Now Channel 4 News has learned that at least 12 mothers or their families are taking legal action. There are allegations of caesareans done with insufficient anaesthetic, of a mother left alone to give birth on a dirty floor, and a stillbirth that could have been avoided. This is Serena Ali at her wedding. But 4 years later, in January this year, she and her first baby were dead. The subsequent report said hospital staff failed to spot the signs of a ruptured womb. They then tried to resuscitate her with a disconnected oxygen mask. The trust has accepted that the care given to her was of an unacceptable standard. And in March, the Care Quality Commission, which regulates and inspects health services in England, issued a warning notice to Queen's, saying women and babies were being put at risk. This is a summary of the report compiled after Violet Stevens' death, and it makes disturbing reading. It says there was a delay in transferring her to the labour ward. It says they didn't recognise that her health was deteriorating. Miss Stevens, who already had 2 children, was admitted to Queen's with preeclampsia, which can be life-threatening. The report documents a succession of failures in Violet's care. In the 3 days before her death, she saw 5 different consultant obstetricians, 11 junior doctors, 12 different midwives and 2 nurses. There was a failure to administer a blood transfusion as planned, a delay in making the decision to deliver her baby, tests were carried out late and results not looked at in good time. And when she was found unresponsive with gasping breath, it took 25 minutes for a cardiac arrest call to be made. Today, the hospital told us that there had been staff shortages, but that more midwives have now been recruited. They said that more training had been put in place and that there was now a better complaint system.
I want to, through this interview, on behalf of the Trust, apologise to any women who have felt let down by us. These events that you're talking about happened some time ago, and I can't guarantee that there'll never be another event, but I can guarantee that we're putting everything in place to minimise the risk to women and to make sure that this is a safe unit for women to deliver their babies.
But the solicitor acting for these women said the problem was far deeper than staff shortages.
All hospitals work with staff shortages, and they don't have the number of tragedies that have occurred in Queen's. And when Serena Ali sadly died in January this year, there was a full complement of staff on the ward. It was not to do with staff shortages, it was to do with bad management, bad communication, and a very poor attitude of the midwifery staff towards the patients.
Queen's Hospital is now waiting for the results of a full investigation into its services by the Care Quality Commission, which is due early next month.
But shortly after we interviewed Georgina Lloyd, she had some good news. She learned that the Trust has now admitted negligence.
Victoria MacDonald reporting, and at 7:30 we'll be discussing the pressures on maternity services across the country and asking whether there really are enough midwives to cope.